歡迎大家嚟到今日。
Welcome to the press briefing. On stage, we have Dr. Edward Choi, Controller of Center for Health Protection, Dr. Chang Chuk-Kwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Kai-hin, Chief Manager from HA. Dr. Choi, our friends from the media, fellow citizens, good afternoon. As of the 13th of January, we have got 327 Omicron cases, confirmed cases, 295 imported and 32 confirmed local cases. Taking into account highly probable cases, we have got 60 local Omicron cases. These cases have come from two major groups or clusters. So Dr. Zhang may report to you cases arising from these two groups. I will give the floor to Dr. Zhang. Thank you. There were 9 cases tested negative. Case number 13022 to 13030, 8 carrying N501Y variant. And the rest are T478K. And for the remaining one case, the result is pending. 13022 is a construction site worker. His test was negative consecutively upon admission, so we have to observe him for a few more days. He was tested positive, carrying N501Y variant, but T747K, unfortunately, because the viral load was too low, we could not tell whether it was a positive case or an Omicron case. So we will have to keep him under observation for a few more days to see whether he'll be continuously negative, or will he become positive. He lives in Yat Wan House of Tin Yat Estate. He's been working in, has been replacing gas pipes at TMHK, and some fellow workers have to be quarantined. As we said yesterday, we have to observe this case. He's got a few workers, or a few healthcare workers have to be put under quarantine. There are 2 cases linked to other cases. The case I referred to was 13022, and I'd like to talk about 13026, a clinic nurse living in JC Place, Town 1. We talked about this previously. Yesterday we mentioned another preliminary positive case. The viral load was only 35, 36. When the sample arrived at our laboratory, D616D variant was found. It was a vaccine strain. N0156, etc. were all not tested or negative. So the sample was taken in a clinic. One of the 4 clinics where they worked for at Chilok Garden. And so we went to that clinic and took 21 samples. To see whether it was a vaccine-contaminated case. The samples were sent to Professor Yuen at Hong Kong University, and it was reconfirmed that it was a positive case because of vaccine contamination. So this is no longer a case, and we haven't assigned a case number to it. She lives in Block 2 of High-Tech Garden, which was restricted and tested last night. There was unconfirmed or uncertain case this morning. Upon retesting by our laboratory, it was a negative case, so High-Tech Garden doesn't have any confirmed case now. Residents do not have to take the compulsory tests. arising from these two cases. Subsequent tests do not have to be done. And another linked case is a close contact of a confirmed case living in City Garden, Block 3. I mentioned yesterday that the case was sent to a quarantine center on the 5th of January, and now it is a confirmed case. We have less than 10 preliminary positive cases. One is a close contact of Phase 3 of Phoenix Garden. There are 2 units affected, and this case is a family member of the unit in the lower story, and the case was sent to the quarantine center on the 8th, and then the case developed fever on the 13th. Now it is a preliminary positive case. Another preliminary positive case is a colleague of a case from Penny's Bay. It's a 51-year-old female who served BOC property services as well, working in Penny's Bay Quarantine Center, a colleague of case number 13004. They ate together, they took lunch together, and their work nature is very similar. We believe the transmission was when they had lunch together when at work, so the case was infected. The case didn't have any direct contact with other confirmed cases. And then I'd like to discuss some earlier confirmed cases. There was a cleaner of a flight cabin, and then a case was 12908. We said that there was CX845 and case 12771. The genetic analysis is 100% the same as 12908. So it's likely that 12908 had to clean the plane, and then the case was infected while doing that. So the case would be classified as an imported linked case, and 12777 arrived to Hong Kong on the 4th of January on CX845 sitting at 46K. 12908 was responsible for that section of the plane. There was another case, 13004. As said previously, the genetic sequencing is identical to that of 12960 at Penny's Bay Quarantine Center. 13001, who lives in Phase 3 of Naples Garden. The genetic sequencing is identical with a case 12986. So this is a vertical transmission, so the 2 cases are linked. That's all from me. Can I 72, but we have yet to find out the link. We have less than 10 preliminary positive cases now. Next. Over there. Good afternoon, HKET. Regarding the security worker at Penny's Bay, was she responsible for handing out supplies to the people there? And is she the first security guard to be positive there? What is the source, and have you traced the number of people under quarantine she had contact with? Would you have to lengthen the period of quarantine? Now, we have got a confirmed case arising from Penny's Bay, and the case has brought the virus back to the community. So do you think you have to strengthen the personal protection measures for people there? And then you talked about the clinic case. Now, people were subject to mandatory testing, and so some people went to the clinic to give samples. Was it that in the process the nurse touched some vaccine? Because I didn't quite that clearly. And for the negative positive case, we're told that the case is a doctor working in a laboratory. Is it because it was a false positive case because she or he was contaminated with vaccines? And 12838 concealed the fact that she had been to a birthday party and that she had been to Nabe Urawa. I'd like to know the case of the progress and whether there will be any prosecution. We talked about a prosecution, and then Dr. Zhang, we talked about the linked cases. We know that many people work in places that are high risk, and that include quarantine facilities, because people that frequent quarantine facilities may subsequently become positive cases. Another high-risk place is the airport, where people will have to be tested upon arrival. So depending on the level of risk of a place of work, we take great care with the PPE. The putting on and taking off of PPE is a high-risk procedure, and very often infection takes place at that point. And so we will check people working at high-risk places. We'll see whether the putting on and taking off of PPE are up to standard. And as for the transmission among security guards, perhaps Dr. Zhang can brief us on whether there could be human-to-human transmission during their working together or eating together. If we suspect any case that has violated CAP 599D, that is, if they have concealed facts from us or given us false information hindering our investigation, we will consider taking legal action. The cases where prosecution proceedings are underway, but we cannot disclose the details, but the answer is positive. In handing out supplies, yes, the staff may contact people under quarantine, and 13004 had once was once at the door of a confirmed case, and one did not have that situation, but the two ate together in a container, and they sometimes rested there together, and the two are in fact close contacts, and the latter case have been sent to a quarantine center anyway, so it's more likely that the case was infected by the other. And as for taking of samples, a confirmed case who's a nurse, 1313026, when the case was preliminarily positive, we contacted the clinic, and one of the doctors asked all medical personnel to go to the clinic at Chilok Garden so that they could be subject to testing. And one of the clinics helped to take samples, and in the process, she took out a vaccine, wanting to inject it. But then, before she did that, she helped to take a sample from another worker. Of course, she had washed her hands before that, and then she took a sample from a preliminary positive case. Perhaps there was contamination in the environment, so that another nurse sample was preliminary positive. So we went to the place to check, to understand the situation. We took some samples. The samples were confirmed by our laboratory and Hong Kong U that the sample was contaminated by vaccine. It was not really an infection case.
You mentioned the person from Hoi Tak Garden during the RTD. The sample wasn't a COVID variant. It was a negative case. Last question. Anyone who hasn't quite asked a question? If not, then supplementary. No, it's not necessary. You're referring to the Penny's Bay people. They all have all the precaution taken. They have the PPE before they see the quarantine leads, so the risk is pretty low. Now, for the Whitman Hong birthday party, day before yesterday, you mentioned 222, and now you added 2 who turned up after 9:30. Is it 224? 225. The total is 225. That's it for today. Thank you all very much.